So my session is actually a continuity of what Rahila just covered. So basically in my session, I'll be talking about mainly the quantitative research methods. It's not exhaustive, but they are the main ones. And also I'll go through another major evidence synthesis exercise or methodology, which is meta-analysis. So without further ado, like I said, I'll cover these main two aspects in my talk. So first of all, quantitative research, an overview of the different quantitative study designs to help the reviewers differentiate between approaches. So a very quick, brief overview of what do we mean by quantitative studies. The most intuitive way to answer that is the studies that involve a lot of numbers. So normally it's a study about a particular group of people, which we normally mention them as the sample population. And we use numerical data to describe them. So purpose of analyzing the numeric data normally include to describe the characteristics of a certain population or sample population, to detect any correlation between variables and test some hypotheses, and also to predict future events. So examples here. So when we review or when we read the quantitative studies, first of all, we want to see some description about the characteristics of the participant or the study objectives we have. So normally I'm giving you an example here is a table of patient characteristics. So if you have a quantitative study looking in the clinical medicine or public health research field, normally this will be the first table in the results section that gives you a quick overview of normally who are the study objectives or the focus of this research, and how large is the sample size, total number of participants or total number of patients in this study cohort, who are they, and what the major characteristics they have, including some demographic information such as gender, age group, ethnicity, but also something more. For example, like this study was focusing on healthcare associated infection in COVID patient. So later on, you will see different study characteristics, including, for example, SARS-CoV-2 test positive or negative. The second purpose of quantitative study is normally used to detect correlations and test hypotheses. So here I'll give you another example. The hypothesis we're testing here is to see whether the patient infected by the alpha variant of COVID compared to those infected by the wide variant of COVID, they behave differently in terms of the incidence of bacteria and fungal infection. So here I want to highlight 3 bits in this kind of like results or conclusion bit. First is the case definition. So I will cover all these terms later, but I will just mention here in this example. The case definition has been described here. What do we mean? What do we mean by our COVID patients? Each study will pragmatically have their definition for different things. So in this study, we define that a patient with a positive nasal oral swab of SARS-CoV-2 virus is a positive COVID patient. Okay, so that's a case definition we use. And then the second thing is assumption. So assumption here is we assume that any patient tested for something we call S gene knockoff. So basically it's a genetic technology we normally use. We assume anyone with this gene tested, meaning they have been infected by the alpha variant of COVID. And then the third thing is we tested any correlation. And then in this study, we didn't find any significant correlation from a statistic perspective. So we conclude that there was no significant difference in the possibility of patient getting bacterial infection. It doesn't really matter they're infected by the COVID alpha variant or the wide variant. So this is an example of using numeric data to detect correlation and test hypotheses. And the last one is normally the most interesting thing is to predict events. And sometimes these events has not yet happened in real life. So again, this is an example from one of my publications is using data to predict prescribing volume. So in the figure, you can see two lines. One is dotted and one is solid. The solid blue line is what we observed, that is the real life things that happened in real life, while the dotted line is what we predicted. This prediction has been made under a scenario that what if COVID hasn't arrived, what would the prescribing volume would be? So it's a prediction based on historical data, while we compare our prediction with what we observed in real life, which is a dotted blue line. So these are the third common purpose when we analyze numeric data, is to predict events. So there are different types of quantitative studies, and sometimes terms has been used interchangeably and cause a lot of confusion. But overall, quantitative studies can be categorized based on different aspects of study designs. So mainly, it's about what the focus is. And please keep in mind that there is no perfect study design or perfectly right or perfectly wrong. It really depends on the purpose, and every single type of study design will come with its own limitation. So when you review a paper, if you understand the study design, automatically you could have kind of think of certain limitation associated with a certain study design. And then later on, you could compare your prediction with what the authors has written. Some authors will be very transparent about the study design limitation, or sometimes certain things have been hidden. So so these are things that can help you to think of whether there's assumptions or limitations associated with the study design that hasn't been mentioned in the manuscript. So first of all, we can look at when the studies can be separated, depends on when the data was collected. So if the data was collected before the study started, normally it's collected so the data was collected for other purpose than research, and is collected before the research was conducted. So and then later on, we decide to do this study, we go back to retrospectively extract this data. Normally, it will be extracted from, for example, routine administrative data, routine hospital data for the past 10 years or past 5 years. So it's retrospective study design. Compared to that, we also have certain studies that data was collected after the study started. So often, the data was collected based on the research questions and objectives. So the data collection will be more tailored towards the research purpose. So this is the type of study we call prospective. For example, we can recruit tuberculosis patient for the next 5 months that come into my hospital, and this recruitment process and data collection will be solely tailored based on my needs, based on the research question I'm going to answer in this research. So also we can separate study based on how often the data was collected. If the data was collected by following the same samples for a period of time, we call them longitudinal study. For example, you can follow up a group of COVID-19 patients from admission to discharge. So you follow them every day, and they are the same samples in the study cohort. Or the data was collected at multiple time points for the same population, we'll call them the panel data. So keep in mind that these are the same samples, just being snapshot at different time, okay? So we can measure a group of patients, the body mass index every year after they have their gastric bypass surgery. So they are the same group of patients, we just assess them every single year. The third type of study is cross-sectional study, where data was collected at multiple time points for different samples from the same population. And this is where the confusion always comes from, because panel data analysis and cross-sectional study sometimes cause confusion. The difference is, so if I'm giving you an example of a cross-sectional study, I can conduct a point prevalence survey every year to see how much antibiotics were prescribed to treat catheter-associated urinary tract infection. So each year, I will see in this hospital how much antibiotics has been prescribed to treat this infection. But every year, when I do this cross-sectional study, it's different patient I'm assessing. It's the same setting, but different patient every year. So it's a different samples from the same population. I just assume that whoever coming into this hospital or sample is representative of the local population I'm studying. So this is where things get a bit confused. But the major difference between the panel data analysis and cross-sectional study are whether they are the same sample or the different sample of the population. And keep in mind that all this type of data can be support to do something we call the time series analysis. If you believe that there is some association between the variable you are interested in and time. So the other way to separate studies are looking at whether they were comparison. I think that's the most important ones we normally use especially in public health and health management research, because normally we want to implement certain interventions and evaluate them. So if the data was collected for multiple samples at the same time and compare them, we normally have clinical trials or case control studies. Clinical trials simply patient who receive or not receive certain treatment, or being exposed to not exposed to certain intervention. While case control study, case control study is it's mainly about exposure to certain risks. Instead of you introduce the intervention, there might be some naturally occurring risk factors, such as, for example, smoking, secondhand smoke. They are the risk factors you want to see the exposure. We also have the study where the data was collected at the same for the same sample at different time. So, for example, the before-after study or the pre-post intervention study. Patient before and after receive certain treatment. Keep in mind that this type of study can also have controls, which are the people who never been introduced to your intervention. And the last type is the data was collected for a population, but not a sample. So this is normally under the scenario that this is just impossible for you to sample a population. For example, this type of study, we refer them as natural experiment or quasi-natural experiment. For example, when you're evaluating an intervention or event that happened to the whole population, such as the COVID-19 lockdowns, so you cannot sample a population who's been exposed to lockdown and then a sample that has not been. This is just an event that happened to everyone. So for this type of study, we call them natural experiment. So these are the major type of studies, quantitative studies, and they have been classified based on different aspects and different focus, and they have overlaps. So now I'm coming into the last type of study, which is the most unique and specific type of quantitative study, which is a modeling study. Modeling studies are normally used to simulate or predict events that have not yet happened in real life, or something that will not happen in real life. For example, like the example I used before, the prescribing under the scenario, what if COVID didn't happen? So we know that COVID has happened. So this is this is a scenario that would never happen in real life. However, I still want to predict that to see, what is the deviation of our prediction from what we actually observed in real life. So this is a very useful technology to support decision making. Please keep in mind that the model is normally a simplified replicate of real life scenarios. So it's very crucial to understand that every model will come with assumptions, and the assumption is the most crucial part because it directly influences the conclusion you draw from the modeling study. But often some authors tend to hide the assumptions because assumptions made the model very simplified. So people don't want to describe it because they feel like, wow, it just made my model further and further away from the more complex real life scenario. So I want to now go on to meta-analysis, because meta-analysis actually is a type of modeling study as well, but it combines systematic review, evidence synthesis, and modeling. So what it is and why is it very useful? So meta-analysis is a specific type of modeling study, as I mentioned. So it systematically synthesizes or merges findings from single independent studies and calculate an overall effect. It is a model because in real life, the studies or study objectives or the patients from different studies have not met each other or never been sampled together. So we just build a model, just assume we assess them together and what is the overall impact of a treatment or intervention or new drug, etc. Meta-analysis does not simply pull data from smaller study to achieve a larger sample size. So what does that mean? I'm going to take you through a very simple step-by-step approach. So normally we go through 4 major steps to conduct a meta-analysis. Step 1 is a systematic review, where Rahila already covered. So after you conduct a systematic review, if you feel like for your research question or for your research purpose, it's critically important not just to combine the qualitative evidence, but also combine the quantitative evidence from each individual studies. So after your systematic review, you should start to conduct a meta-analysis. So the next step is the data extraction from each individual studies you included in the systematic review. The third step is standardize the study results and weigh different studies. And last one is to estimate the final effect. So a quick arbitrary example here. Imagine I'm conducting a systematic review to estimate the effectiveness of a new COVID-19 vaccine. All right, so first I will search for literature and see how many publications were there describing the effectiveness of this certain new type of COVID-19 vaccine. So I end up with 2 studies. Study A giving a sample of 120 vaccinated patients, of which 5% got COVID-19. Compared to that is 100 unvaccinated patients, of which 20% got COVID-19. And then I have study B, where I have 90% vaccinated patients, while 16.7% got COVID-19, compared against 70 unvaccinated patients, of which 17 got COVID-19. So how do I combine the results of these 2 studies together? Do I just do some do some adds up of the percentage, or do I just calculate the overall mean? So not necessarily. So the next step is to standardize the study findings and weigh the studies. What do I mean by that? So if we look at study A, we have a larger sample size, first of all, because if we calculate the total study, the total number of patients in this study, we have 220 patients that has been involved in study A. And also, if we calculate the odds ratio of vaccination, we see that the vaccinated patient compared to all unvaccinated one, they have a lower odds ratio. So imagine the unvaccinated have an odds ratio of 1, the vaccinated patient have an odds ratio of 0.2. So the conclusion says, and also the p-value shows some statistical significance. So the conclusion drawn from study A is the vaccine actually worked. And now let's look at study B. Study B has a smaller sample size because we have in total 160 patients, and odds ratio has no statistic significant. So basically we can draw some conclusion saying the vaccine did not make a difference. So what is a conclusion then? We have to understand that, first of all, because of the sample size different, the 2 studies weigh differently. Study A weigh more compared to study B, simply because it includes larger sample size. So which also means the conclusion drawn from study A will weigh more than the conclusion drawn from study B. So if I compare these 2, I'm almost confident to say I combine the results together, the vaccine actually worked, because the study that weigh more has a conclusion that shows statistical significance and a lower odds ratio for vaccinated patients. So normally you will use some model to add. Now it's the time to build a model to estimate the final effect. And then in the meta-analysis, you will normally see a figure like that is what we call the forest plot. Basically, you just list all the studies together and look at the results and compare the results against their individual study weight to draw overall conclusion. And keep in mind that when this type of modeling exercise was conducted, it considered not just the sample size or the individual study weight, but also 2 other very important factors. First is whether the impact or the effect of the intervention was fixed or random. For example, in the example I'm using, I would choose a fixed effect model, because I assume the same vaccination will affect each individual samely. So it's a fixed effect of this vaccine intervention. And also we have to consider the heterogeneity of the study design and also the sample. So imagine if I'm having study A, the patient are sampled are younger and naturally they have higher survival rate. And maybe in study B, the patients are older. So you have the heterogeneity that is in the sample you included in individual study. So all this has to be considered when you pulling the study results together. So meta-analysis is highly technical and it's a modeling approach after all. So that's a very quick kind of overview of the common study, quantitative study design that can help you to make a review decision. So these are some simple rules I normally use when I review a quantitative research article. First, I look out for clearly defined research questions. And also I look at adequate data sources and unbiased samples. And third is sample sizes. For example, multiple center study or national level study will have better sample size compared to a study conducted in a single center or a single hospital, or with maybe just 10 patients. So sample size does matter. And then case definition is critically important because case definition has a direct impact of the conclusion you draw from your data analysis. A very simple example, who is a COVID patient by the study definition? Is it the patient with a positive PCR test? Is a patient with a positive lateral flow? Or is a patient present with more than 3 symptoms? You have to define, you have to look out the author's definitions and what do they mean? How do they define their cases in the study design? And then you can associate the case definition with a conclusion in each quantitative studies. And then you have to also look at the statistical analysis they use. But keep in mind that an insignificant p-value sometimes is normally something over 0.05. It does not indicate poor study quality. It only means the hypothesis can be rejected or the correlation was not detected. And what I found very interesting is sometimes the studies actually report insignificant p-value are the ones with better quality because the author just being very transparent. Okay, the hypothesis we're testing can be rejected or our data cannot support this hypothesis. So keep in mind that insignificant statistic test does not mean poor quality. So also, I think Helen covered that before. The context is very important. The conclusion of certain drug achieved 10% reduction in the disease incidence, but what is the context? What is the patient population? How they were sampled, in which healthcare setting, etc., etc. The context is very, very important. A good research paper will always describe the context, the limitation from the conclusion, and also, as I mentioned, assumption, especially in modeling studies. So it's always very useful to use some quality assessment tools. There are certain type of quality assessment tools for different type of quantitative study designs, but ECROMS is the one we chose to introduce. So Dr. Enrique Castro Sanchez will go through using the ECROMS tool later in the interactive session. So I'm gonna stop here. Thank you very much.